What is black fungus? What are the symptoms and who is at risk? In the recent past, India has seen a sudden surge of the cases of black fungus or mucormycosis. Most of these cases happen on the facial region in the nose or the throat, and very few cases of black fungus or mucormycosis happens in the lungs. Lots of people have asked me what are the main causes of this. Well, it's the sudden rise in the number of people who are on steroids and long dose of steroids, and people who are diabetic whose sugars have not been controlled. We do know that steroids increase your sugar levels. So if you are on steroids, it's very important to control your sugars by an endocrinologist or a diabetologist. The next thing to remember is a lot of patients are now taking a lot of immunosuppressant drugs, for example, tocilizumab and various other things. And that can probably enhance the region. COVID-19 itself causes your serum ferritin levels to rise, and so there is more free iron available for this fungus to grow. One thing to remember about the fungus is that though it's in the air, quite unlike the virus, it cannot be spread or is not contagious. The important thing to remember is only when your immunity is down can it infect you. It's important to remember that when you have symptoms of the black fungus, please do not self-medicate or do not take steam. It can harm you further. What are the symptoms of the black fungus? Well, 2 or 3 weeks after you've suffered from COVID-19 or recovered from COVID-19, if you have persistent fever, if you have severe headache, or you have stuffiness of your nose, or black or bloody discharge, or you have one-sided facial swelling which is painful just under your eye, please go and see an ENT specialist or a doctor. For this is probably the best chance of treating this dreaded disease. Remember that if treated in time, it's a completely treatable condition, either with medications or with surgery. But if not treated in time, it is very fatal. So the most important thing is to recognize the symptoms and treat yourself immediately.